Hi everyone, we're here with our patient Will and his lovely wife Terry, and we have a special message for you because I'm proud of Will, what he's done. Even though he was really loud in the treatment room yesterday and he was annoying all the other patients, but he toned it down. Terry's used to it, obviously, right? Yes. But Will's a kidney patient, so we want to talk about the importance of diet, because I get a lot of pushback. And the problem is, we discussed yesterday, a lot of nephrologists are telling people on dialysis to eat more protein. And you actually want to eat less protein because protein is really hard for the kidneys to filter. So how much weight have you lost today?
Total of 30 pounds.
30 pounds. And what have you done to lose the 30 pounds?
Oh, it has been a tremendously bad diet I have been on.
Oh, God.
As you understand.
You know what? This isn't going up on YouTube. Forget this. I'm just going to have this on my phone. It's staying on my phone. Good God.
It's fresh vegetables, fresh fruits.
Yeah.
Laying off the protein.
Yes, and the dairy.
And the dairy.
And the grains.
And the grains. Yeah. And I'm susceptible to that yeast rolls that you can get.
I mean, who doesn't love it, right?
That's one of the big things.
Yeah.
And sugar is so insidious because it's in everything. You read
it is.
Balsamic vinegar and they've got corn syrup in it.
Yeah.
You know, that's really bizarre. But I've laid off of the sugars, the grains, the protein.
Yeah.
And I have found peanut butter that is just peanut butter and sea salt,
yeah,
and celery, and so those are my snacks instead of cereal.
So you've made a lifestyle change. Now this is your first round. This is your first visit here from Ohio. How long of a drive was it?
Well, it's normally 8 hours, but through the snow a couple of days ago, it was 13.
Oh my gosh! Yeah. So this is what I mean. We get people from all over, but you're right. You have to make a lifestyle change. That's one of the key factors, and that's why we accepted you as a patient. And we don't accept everybody. If you're still going to smoke and drink beer and eat like crap, you're not going to heal, and you're not going to get to where you want to get, and then you're going to blame me. And I'm not taking on that weight of the world. So, you've done a great job, and to lose 30 pounds, that's fantastic.
Well, and he's had stomach issues, and they were telling him everything very cooked, very processed, so that it would all melt before it got to your stomach.
Nice.
And he would be
that make it worse.
And he would be awake in the middle of the night, just ready to give up.
Right.
And just from the diet, he's like 95% better.
See, his wife Terry notices it. Thank
amazing.
God. She's going, thank God.
Oh, yeah.
It's about time.
I'm less of a bear than what I
Yes,
was
exactly.
2 months ago.
It takes one to know one, though. My wife will tell you, she goes, if I'm kind of ordinary, she'll go, have you eaten? Yeah, totally.
Yeah.
Are you sure? You want a salad?
Salad, yeah, really.
I'll make you a salad.
Fresh bowl of berries work wonders.
Exactly.
I become docile as a lamb
There
at that
it
point in time.
It takes one to know one. See, that's it.
Yeah.
And what you have to endure, along with my wife. See. So what we're going to do is we're going to monitor your progress. So the next time you're back, we expect to see some change. Now, look, it's not just stem cell. That's part of the reason. Let's talk about that. You decided on this clinic. So
I did my due diligence. I have talked to people. I have talked to people in Panama, Florida, a couple in California, one in Pittsburgh, several in Chicago, here, and everybody claims to have the world's best stem cells. And I've heard that lecture in line before from other places, but I knew it had to be more than just stem cells.
It is, totally. And I know that personally.
Yeah. So I'm learning it.
Yes.
I'm learning it.
So before he leaves, you're leaving Thursday.
Tomorrow.
What we're going to do is we're going to have the remedies for you. We've already got the blood work done. We're no point in doing the hormones till we get pregnenolone handled. I mean, that was very low. And so in pregnenolone I talk about in my videos, but it's the major fat that makes up your brain. We're going to do the brain gauge on him now. So we're going to check and see what's going on with his brain. So we're going to have you use a portable PEMF unit, pulse electromagnetic field therapy, on your kidney acupuncture points, but also on your brain, because frontal lobe fires to lower brainstem. That controls the vagus nerve, the organs, autonomic nervous system. And so it's all layered in. It's not just one thing. We've got to look at your genetics yet. That's going to come. It's everything. It can't be just one thing.
It just can't. No.
If it was just stem cells, too easy. But the reason stem cell therapy doesn't work, the primary reason, folks, is inflammation. And if you've got a ton of inflammation, it's just, yeah. It's
and I have a ton of inflammation.
Yeah,
for sure.
I think I dropped your chart again. I'm dropping everything.
It has been quite an education.
Thank you. Yeah.
From the standpoint of I have been seeing doctors for 3 years, every 3 months, a gastro, a nephrologist, a primary, and every 3 months they're doing blood work, but no one's done as thorough of a blood work.
It has to be extensive.
As what this is, and it hasn't been.
So let's just run down a few things. Your GFR is only 16.
Yeah. Your
pregnenolone is only 10. Pregnenolone, folks, should be, with kidney patient, up around 200, 150 to 200. Your blood urea nitrogen right now is 50. Creatinine is 3.72. We've got some work there. Your sodium is a little bit on the high side. Phosphorus is a little high. Your liver. So this is what I see with every kidney patient, and this is why I wanted to bring up the blood work. It's not just kidney. Will also has a liver issue. And so people aren't addressing that liver issue. They're just microscopic on the kidney.
Yeah. Modern medicine is so compartmentalized.
Well, that's it. We were talking about that yesterday.
If you're not taking and you go to see, it used to be a primary care physician, a town physician. I mean, he delivered kids, right. He set broken bones, did minor surgery. Yeah. Nowadays, if the primary care, you walk in, they give you an antibiotic, give you the flu shot, tell you to go home, and then go to the specialist. Right. And the specialist deals strictly with kidneys, or adrenals, or gastro, and so no one sees the whole picture, and it has to be a whole picture here. Yeah. It just can't be just individual compartments, and nothing gets done.
And they're dealing with their symptom,
right?
And they're not looking for the underlying
cause
that's
what's the cause?
Everything.
Yeah. So here's another thing. They had you on statins. Your cholesterol's 98. You need your cholesterol for your brain to make pregnenolone, to make your hormones. It's 98. It should be like 220. I mean, so you went to your physician and said, "Hey,
I did my education and due diligence also. I could walk in, and I had looked at the studies that they have done, and come to find out that in several years ago they did a study in which they took people off statins and left them on statins, and there was a 1% difference in who had a stroke and who had a heart attack. And go up on PubMed. It's there. Yeah. It's there. Just go find all the research you can. Yeah. And I went in, and I was on 40 milligrams, and I'm sitting there going, I had 1/10% of what I should have for testosterone. I was so fatigued. Yeah. I could lay in bed for 20 hours a day and still not have enough rest. Right. And so they took testosterone, and lo and behold, I had literally none. Yeah. And so they put me on 100 milligrams every 2 weeks of injection of testosterone.
Yeah, which causes prostate cancer.
And so we're trying to push the boat from the bottom up.
Right.
That's and
it. Gotta be top down.
I hauled off and fought her for it, and we have reduced with the diet and everything. I have reduced half the insulin I have been taking. And I take 3 different insulins. Yeah. And so I've cut that in half in a month and a half. She reduced that, and she reduced the statins by half. Right. And so hopefully with taking pregnenolone, the dietary supplement, and half of what I was taking for the statins, I'm hoping to get a little bit more testosterone, a little bit more pregnenolone, and I'm feeling a lot better. I'm functioning a lot better.
Yeah.
The brain fade was so bad that there were weeks at a time I couldn't remember her name. And after 23 years, you don't remember your wife's name.
Yeah.
I wasn't remembering my own name.
Yeah.
And couldn't tell you the date or the time.
All right, so let's talk about your inflammation. Homocysteine, normal 6 to 7, you're at 28, so that's pretty high. Fibrinogen shouldn't be above 350, you're at 476. That's a lot of inflammation. Then you couple that in with your vitamin D, and your vitamin D is 37, and you really want it 80 to 100. So we have some work here. We have some work with the brain gauge. We have a lot of work to do, the homeopathic remedies, but you throw all that in, and you also have Hashimoto's, like me, so you have an autoimmune thyroid. So, will the project, right? It's like
I was a walking disaster.
Yeah. So, but the whole point, and the reason we're making these videos is because of the fact that you've changed already. And we're going to change it more, and you've changed for the better, and you've already the physician has to admit that,
My primary has admitted we did the blood work for LabCorp here.
Yes.
2 weeks or 3 weeks later, we did it the normal A1C and the normal blood work she does for iron and RBCs and WBCs, white blood cells and red blood cells and platelets and such, because I'm severe anemic.
Right.
And come to find out, I've actually improved that in the 3 weeks in between the 2 lab tests. And she was very happy about that. She was happy about it. Actually has showed some progress with the thyroid. Yeah. And so she's really
she's seeing change.
She is seeing change, and I'm lucky from the standpoint that my primary, she actually knows about this. My gastro knows about this, and rightly she approves, and she approves of it. She understands that this was a Hail Mary pass,
right?
Because according to the nephrologist, if I didn't do anything, I would be dead in 2 years, because I went from normal 3 years ago to 16 on a GFR in 3-year time period.
Yeah, that's pretty fast.
That's a very fast time period.
Gradually.
Yeah, no, I was plumbing off the cliff. And they had measured me for vein mapping to put the fistula in,
right. I remember you saying that.
Education, dialysis education to start me on, to get me on dialysis before the kidney destruction occurs and the major catastrophe. Yeah. And I knew there had to be a better choice and a better way. Yeah. And so that's why I did my due diligence to do this.
Yeah, so you called other clinics. All they were doing was stem cells. Nothing else.
There was one clinic that said, "Well, we'll get you on a diet," but they weren't. The diet is fine, but there wasn't extensive blood work. There's a little bit more to it.
Well, and you can see what we just discussed in your blood work, why it's so important, and just the pregnenolone. So there's no point in doing hormone therapy if your pregnenolone is 10, because all your other hormones are going to be very low. So we need to build that up, get that working better, then we'll come back and do that. But it has to be a holistic approach. You have to look at everything and not leave any stone unturned if you're really going to help serious conditions. I mean, I was just on the phone. Tuesdays are my call day. We're here on a Tuesday. And the gentleman's from the Netherlands, Ben. He's probably watching this video. He watches every single video that I make. He's telling me stuff that I forgot that I put on my videos. So, it's like, and so, but my point being, the reason we get people from all over the world is we do extensive testing to get to the root causes. Why do you have the problem in the first place? Yeah. And that's the key.
For me, the root cause is could be one of 100,000 things.
Yeah.
5 years
it's usually not just one thing.
It's usually not. Yeah, the bad living choices, bad dietary choices.
All behind you now.
All behind me. I will admit, I do fall off the wagon. It is.
He did have a burger. He admitted that.
And you still talk to him.
I still talk to him. I said, okay, you're still in, but one more burger and you're out.
it just makes sense to do all the groundwork
yeah.
to give yourself the best possible
Yeah.
foundation
Hello, right?
to take all these steps.
Yeah.
I mean,
Good. All right. So, anything in closing?
Just come. I mean, just make the phone call. I mean, do your due diligence. That's the first
I
thing
agree
you
with that.
do. Do the education. Do the due diligence. There's a lot of doctors out there that are preaching diets, and the diets help. The diets
it's a part
do
of it.
help. It's part of it. But I was. Besides the thyroid, the kidneys, the liver, the brain, I had a lot of things going on that required a little bit more extensive help than just the diet. I needed the stem cells, and I realized that.
And here we are.
And here we are.
All right.
Yeah, making
Thanks,
progress.
guys.
thank you.
Appreciate it.
Yeah.